Chole Sakana on Shabbat, someone who is critically ill, halachot. There's a interesting halacha that pertains to doctors, so we'll say quickly out loud. A doctor that the phone rings in his house or his cell phone rings. So obviously, any of us who our cell phones ring, you don't pick up on Shabbat because it's probably spam or something to do with work. We don't pick up our phone. But a doctor's work is pikuach nefesh very often. So if a doctor's phone rings, halacha says if it doesn't stop, he's allowed to pick up the phone because he can assume that the caller is someone who is sick and needs critical help in a critical ill situation. And then the halakha says when he puts the phone back down, he should do it b'shinui or two people should do it at once. That way it's less of an issue when he puts it back down. And we've explained this in the past that if someone breaks Shabbat for assuming that it was pikuach nefesh and it appears to be that it wasn't a serious situation, he doesn't need to do tshuva. He won't get punished. It's not a problem whatsoever because we say even for safek pikuach nefesh we break Shabbat. He doesn't need to do any kapara or any tshuva for that action. Now halakha continues and says, what about a regular person who's not feeling well? He has two options. I can call a taxi to get to the hospital. I can call an ambulance. Is there any preference? Is there any preferred method to get help? The halakha explains very clearly. When you need to order or call a ride, a vehicle to get to the hospital, adif lazmin ambulance ma'asher lazmin monit. It's preferred to call an ambulance versus as opposed to calling a taxi or calling a Get or an Uber wherever in the world you are. This is for many reasons. Number one, it has to do with medical reasons. Obviously, a taxi driver, if something actually serious is happening, he won't be able to give you any intervention. He can't help you in the interim until you get there. Number two, the ambulances are obviously equipped and can get there quicker. And also, halachically speaking, there's no reason to minimize in the Isurim. We've explained that once someone's a chole sakana, they are at life-threatening situation. You get them there as the fastest way possible. There's no reason to call a taxi to minimize any potential Isur whatsoever. Now, we just explained in the past, and just to re-clarify that now before we end, this applies to any pikuach nefesh, any and all of the categories we've explained: chest pain, shortness of breath, allergic reaction, all of these things that fall into the category of chole sakana. However, we spoke about this and we'll speak about it in the future. What about a yoledet, someone who is giving birth, or a woman in labor? A woman in labor, although it is pikuach nefesh, we're not minimizing the fact that it's life-threatening to her and the fetus. Nevertheless, because there's a few reasons why, but Magid Mishneh explains the Rambam, because it's something that's the way of the world, and it's derech hateva, and it happens very often. When possible, we try to minimize in the Isurim, in the Avon Shabbat, in the Isur Shabbat, when getting help for a woman in labor. So for that reason, someone who has contractions, again, there's no crowning, the baby's not about to come out. In that scenario, if she can get to the hospital in a timely manner and give birth in the hospital, she should call a taxi or prepare from beforehand a taxi to take her to the hospital. Obviously, in a scenario where it could be imminent birth and that's a situation that's life-threatening, you would call Hatzalah or you would call an ambulance in that scenario as well. But we're talking about a general scenario where it's simple contractions, she's not about to give birth, then in that scenario, she should also call a taxi. But regardless, everyone else should be calling an ambulance. There's also discussion, Jewish agencies versus non-Jewish agencies. Halakha is, we prefer Jewish agencies because they have a faster response time, and they may not care more for the patient as well. So that's just a quick halakha regarding ambulances or taxis. Have a wonderful day. Chazak Baruch.